Hello, my name is Aurora Haynes-Farley, and today I'm going to be doing a head-to-toe assessment, and before I begin, I just want to do a quick 360 check of the room. And so before I begin, I'm going to perform hand hygiene. And clean my stethoscope with an alcohol swab. And now I'm going to don some clean gloves. And I'm going to introduce myself to the patient. So hello, my name is Aurora Haynes. I'm a student nurse. I'm just going to go ahead and check your wristband. And can you please state your full name and date of birth? Sarah Smith, September 18th, 1998. Awesome. So today I'm just going to be doing a head-to-toe assessment on you. Is that okay with you? Patient has given consent. Do you need to use the bathroom before we begin? Patient said no. I'm going to go ahead and provide some patient privacy. So starting off with the general survey, this patient appears to be their stated age with the appropriate development. They have no body odor, their nutrition is good with an even fat distribution, their body parts are equally bilateral, and this patient has a short stature with a thin body build and no obvious physical deformities. For behavior, this patient has the appropriate facial expressions, they are able to maintain eye contact, and they are appropriately dressed for the weather and are wearing clothes that fit their body, and their speech is clear and fluent. I'm not going to have you stand up, and I'm just going to assess for your gait. So I'm just going to have you take a few steps towards me and turn around and go back. Awesome. So this patient's gait was smooth, even, and balanced. They had no trouble walking. There was symmetrical swinging of the arms, and their range of motion was active, smooth, and coordinated. Their breathing was clear, quiet, and even, with no signs of distress. And I'm now going to assess for your level of consciousness. So do you know who you are, where you are, and what day it is? So this patient is awake and alert and is well aware of their surroundings, as they were able to say who they are, what day it is, and where they are. Now moving on to the head. Do you feel any pain? Patient said no. The size is normal cephalic. The shape is round. There are no lesions or abnormal lumps or bumps. There is no swelling. The color is a black, and the hair has an even distribution, and there are no foreign bodies in it. The facial features are symmetrical. There's no lesions, no scars, no edema, and I'm now going to assess for cranial nerve number 7, which is the facial one. So can you smile for me? Show your teeth, frown, puff out your cheeks, shut your eyes, and can you raise your eyebrows? Awesome. So the patient was able to do everything that I asked, so therefore cranial nerve number 7 is intact. And now moving on to the eyes. So the eyebrows are symmetrical. There's an even distribution of lashes. Can you close your eyes and open them for me? No lid leg. The sclera is white in color. The conjunctiva is pink in color. And there's no discharge. I'm going to go ahead and assess for cranial nerve number 3, which is the ocular motor. And for that, I'm going to use the acronym PERLA. So the resting pupil size on the right eye is 4 mm, and on the left eye it is 4 mm. And the pupils are symmetrical and round. I'm going to go ahead and test for direct and consensual light reflex using a flashlight. So I'm going to start from the side, and I'm going to come around to the front. Awesome. So when I did the direct light reflex, when I shined the light into the eye, the pupil did constrict. And for consensual light reflex, the other eye that I did not shine the light in also constricted as well. I'm now going to test for accommodation. So the eyes are now dilated right now. So I'm just going to have you focus on the end of this flashlight, and I'm going to slowly bring it closer to your nose. And as I'm getting closer, the patient's pupils are constricting and converging. So therefore, cranial nerve number 3 is intact. Now moving on to the ears. So the ears are symmetrical and there's no discharge on either side. I'm going to palpate the auricle. Do you feel any pain? Patient said no. I'm going to palpate the tragus. Do you feel any pain? Patient said no. I'm going to go ahead and do the whisper test. So all I'm going to do is whisper 3 words into your ears, and I'm going to have you repeat them back to me. And I'm also going to have you cover or occlude the one ear that I'm not whispering into. All right. Awesome. And awesome. So the patient was able to repeat back all of the words to me, so therefore there's no hearing loss. And now moving on to the nose and sinuses. So the nose is midline, there's no discharge, no crusting. I'm going to go ahead and palpate for the frontal and maxillary sinuses, starting with the frontal. Do you feel any pain? Patient said no. Moving on to the maxillary, do you feel any pain? Patient said no. There's no pain, tenderness, or swelling felt on any of the sinuses. And now moving on to the mouth and pharynx, I'm going to go ahead and inspect the lips using a tongue depressor and a flashlight. So the lips are hydrated, they are pink in color, and they have no lesions. Can you go ahead and open your mouth for me? Thank you. And the gums have no lesions, no bleeding, and they are also pink in color. Teeth are intact and they are evenly spaced out with no dental caries. The tongue has no lesions and it is movable as I can see the patient moving it around. Can you go ahead and touch your tongue to the roof of your mouth for me? The base of the tongue has no lesions and it's hydrated as there is saliva present. You can go ahead and relax your tongue. The soft and hard palates are intact with no lesions, and I'm going to go ahead and assess for cranial nerves number 9 and 10, which are the glossopharyngeal and the vagus. So all I'm going to have you do is say ah for me. Ah, awesome. So when the patient said ah, their uvula and soft palate did rise, so therefore cranial nerves number 9 and 10 are intact. I'm now going to assess for cranial nerve number 12, which is the hypoglossal. So can you stick out your tongue for me? The tongue is midline. Can you move it side to side? And can you say light, tight, dynamite? So the patient was able to say light, tight, dynamite without any tremors, and they were also able to stick out their tongue and move it side to side. So therefore, cranial nerve number 12 is intact. Now moving on to the neck. The head is positioned midline. On the neck, there are no lesions, no scars, no visible masses, no obvious thyroid enlargement. Do you feel any pain? Patient said no. The neck accessory muscles are symmetrical. I'm going to go ahead and palpate the carotid arteries one at a time, and I'm going to hold it for 15 seconds, timesing it by 4, looking at my watch. Alright, so the rate was 80 beats per minute, the rhythm was regular, the quality was strong with a grade strength of +2. I'm going to go ahead and assess the other side. Again, 15 seconds, timesing it by 4. Alright, and the rate was 80 beats per minute, the rhythm was regular, and the quality was strong with a grade strength of +2, and it was equally bilateral. I'm now going to go ahead and assess for cranial nerve number 11, which is the spinal accessory. So can you turn your head from side to side, and can you shrug for me? Awesome, I'm going to have you do that again, but this time I'm going to use my hands and apply some resistance, and I want you to not let me move your head or your shoulders. You can go ahead and turn your head to your left. Awesome, to your right. Awesome, and can you shrug? Great, so therefore cranial nerve number 11 is intact. Moving on to the upper extremities, so if the patient was wearing a shirt, I would ask them to roll up their sleeves. The arms are symmetrical on both sides. There is no lesions, no scars, no edema, no masses. Do you feel any pain? Patient said no. There's no involuntary movements. The temperature is warm and there is no moisture. Now moving on to the nail inspection. So the nail surface is slightly rounded. There's no lesions, no clubbing. The nail palette is pink and it turns white as it grows off of the nail bed. And I'm now going to assess for your range of motion. So starting with your fingers, can you flex them, extend them? Your wrists, can you flex them, extend them? Can you do radial deviation and ulnar deviation? For your elbows, can you flex them, extend them? Can you do pronation, supination? And for your shoulders, can you shrug? Can you do abduction, adduction, internal rotation, and external rotation? Awesome. So while you were doing those movements, did you feel any pain or stiffness? Patient said no, there was no crepitus, no altered range of motion. I'm now going to go ahead and assess for your radial pulses at the same time, holding it for 15 seconds and timesing it by 4. Alright, so the rate was 80 beats per minute, the rhythm was regular, and the quality was strong with a grade strength of +2, and it was equally bilateral. Now I'm going to go ahead and assess for your grip strength. So can you grab onto my fingers and can you squeeze for me? Awesome, so the grip was strong and it was equally bilateral. Now moving on to the lower extremities. If the patient was wearing pants, I would ask them to roll them up for me. There are no lesions, no scars, no masses, no edema. There's no moisture, no diaphoresis, no involuntary movement. Do you feel any pain? Patient said no. I'm going to go ahead and assess for the posterior tibialis pulse at the same time. Alright, so the rhythm was regular and the quality was strong. It had a grade strength of +2 and it was equally bilateral. I'm now going to go ahead and assess for the dorsalis pedis pulse, both at the same time. So the rhythm was regular and the quality was a little bit weaker. I had a grade strength of +1. It was harder to palpate, but it was equally bilateral. And now I'm going to go ahead and test for your dorsiflexion and plantar flexion. So using both your feet, can you do dorsiflexion and plantar flexion? Awesome. I'm going to have you do that again, but this time I'm going to use my hands to apply some resistance. So can you do dorsiflexion? Awesome. And can you do plantar flexion? Awesome. So it was strong and equally bilateral, and now I'm going to go ahead and sanitize my gloves. All right, and moving on to the thorax and lungs. If the patient was wearing a shirt, I would ask them to roll it up for me. So the posterior thorax is midline and symmetrical. There are no scars, no lesions, no masses, no edema, no pulsations. Do you feel any pain? Patient said no. The APT ratio is 1 to 2. I'm going to go ahead and assess for a symmetrical chest expansion. So I'm going to place my thumbs at T9 or T10, and I'm going to pinch up a little fold of skin. So can you take one really big deep breath for me? Awesome. So as the patient inhaled, my thumbs moved apart symmetrically, so therefore there is symmetrical chest expansion. And now I'm going to go ahead and auscultate all 9 areas of the posterior thorax for the breathing sounds. And I'm going to have you breathe deeply for me, in through your nose, out through your mouth, and I'm going to listen for a full breath cycle at each area, so 1 full inhale and 1 full exhale. All right, so there was no wheezing, no crackling, the lungs sounded clear, and I also heard bronchovesicular and vesicular sounds. Now I'm going to go ahead and assess for the patient's pulse. 15 seconds, timesing it by 4. All right, so even though I told the patient that I was assessing their pulse, I was actually assessing their breathing rate, and this patient took 17 breaths per minute. The rhythm was regular, and the quality was smooth, even, and effortless. And now I'm going to go ahead and carry on with the thorax and cardiovascular assessment. So I'm going to go ahead and auscultate all of the valves, and I'm going to state the location of them, and I'm going to use the acronym All Pigs Eat Too Much. So starting with the aortic valve, which is on the right side of the sternal border in the second intercostal space. Now moving on to the pulmonic valve, which is on the left side of the sternal border in the second intercostal space. Now moving on to the Erb's point, which is in the left side of the sternal border in the third intercostal space. Now moving on to the tricuspid valve, which is in the left side of the sternal border in the fifth intercostal space. Now moving on to the mitral valve, which is on the left side of the sternal border, the left midclavicular, and it's in the fifth intercostal space. All right, so now that I'm in the mitral area, I'm going to go ahead and assess for the apical pulse. All right, so the rhythm was 80 beats per minute. The rate was 80 beats per minute. The rhythm was regular, and there was no extra heart sounds. I'm now going to go ahead and assess for S1 and S2 sounds. So S1 sounds are best heard at the apex of the heart near the tricuspid valve and the mitral valve. And I'm now going to assess for S2 sounds, which are best heard at the base of the heart, near the aortic and pulmonic valve. Alright, so S1 and S2 sounds were heard. Now I'm going to go and assess the abdomen. So I'm going to position this patient laying down. And I'm going to drape this patient to provide some privacy. That. And so the abdomen is symmetrically bilateral. The umbilicus is midline and inverted. There are no lesions, no scars, no pulsations, and no striae. I'm going to go ahead and auscultate all 4 areas of the abdomen. I'm going to listen for bowel sounds. Starting at the lower right quadrant. Moving to the upper right quadrant. Going to the upper left quadrant. And going to the lower left quadrant. Alright, so at all 4 areas I heard normal, high-pitched gurgling, bowel sounds, and I held it for a minute at each of the areas, and I heard about 10 bowel sounds at each area within that minute. So now I'm going to go ahead and palpate the abdomen. So I'm going to start at the lower right quadrant. So I'm going to do light palpation. Do you feel any tenderness or pain? Patient said no, there's no pain, no superficial masses. Going to the right upper quadrant. Do you feel any pain? Patient said no, there's no tenderness or superficial masses. Going to the left upper quadrant. Do you feel any pain? Patient said no, there is no tenderness or superficial masses. Going to the lower left quadrant. Do you feel any pain? Patient said no, and there is no tenderness or superficial masses. I am now going to palpate for the bladder. So I'm going to use light palpation. Do you feel any tenderness or any discomfort, any pain? Patient said no, and there is no distension. And that is the end of my head-to-toe assessment. Thank you.